Hello and welcome to the Care Academy induction. So, what's this about and why am I doing it? Now, I know some of you have worked in care before, and the problem with that is we all have different ways of working. The idea of the Academy is to hone your skills and your crafts to ensure that you're working in a safe and effective manner. What it means to our employers is the fact that they've seen our induction programme and they've approved to the quality of the teaching and the learning and the skills, knowledge and behaviours that you're going to learn. So, does it matter if you've already done it before? Why am I doing it again? Well, the problem is we have to quality assure the knowledge that you have, and the only way we can do that is if we put you through the teaching and learning again. So for some of you, unfortunately, if you've already done it, it may feel a little bit repetitive. However, for those that haven't done it, you will find a wealth of knowledge and experience. So let's explain what happens. Once your application is approved, you'll be given 15 online modules that you need to complete. Those 15 online modules demonstrate to us a couple of things. One, that you have the digital skills required to complete an online programme as well as face-to-face and classroom-led. Two, it shows that you're an independent learner, so it enables us to have the confidence that you can complete the course. Three, it provides a really good foundation to care, whether you're going in at level 2s, level 3s or level 5s. It means we know you've had the same level of knowledge provided. Once you've completed those 15 modules, you'll then be invited to our 3-day Skills Academy. In the 3-day Skills Academy, you'll be tested against the practical skills that you should have to work in the care industry. So that'll be things such as moving and handling, first aid, medication management. During that period, you may be invited to the job section, and that's 1 day around employability skills, writing CVs and interview techniques if you're unemployed. If you are employed, you don't need to attend that part. Now, once you've completed that, we then start to look at advanced skill practices. So we've called that the Care Academy Plus. Now you'll find this all in the handbook below. In those 2 days, we'll look at advanced skill practices such as tracheotomy, wound management, stoma care, etc. So they may be skills that you've never done before. Now, the reason we do all of that is by the time you finish our Care Academy, you will have completed a robust employees induction, meaning if we put you forward to jobs, they trust the information that we've given them and the fact that you've gone through a thorough induction process, and that you're safe now to work in the care sector. Now, it's important to know that our Care Academy is not funded. It's not part of an apprenticeship scheme, and it's not part of any government funded. It's not supported in any way, meaning we pay for this because it's important we have the right people and give them the right opportunities. So if you do drop out of the Care Academy, there will be a financial fee to pay. So it's important that you stick to it and pass, because it means you're taking up an opportunity for somebody else. So please think really long and hard that this is the right course for you. That information is on the application form, and you can read that in the training agreement as well. Now, on the assumption that you've completed all of that, you'll then be invited for our 3-day study skills. And what those 3-day study skills do is they prepare you to be an apprentice. So it provides you the groundwork you need to understand how to write essays, conduct research, and how to be an apprentice. Now, that's what's our academy, and the aim of that academy has 2 really strong outcomes. Outcome 1 is it gets you work ready and employer ready, and outcome 2, it gets you apprenticeship ready. Now, let's talk about the apprenticeships. So we have our level 2 adult care worker, our level 3 adult care worker, our level 5 assistant practitioner, and our level 5 leadership and management in health and social care. So at level 2, it's between 12 to 14 months long, and you'll be attending classes and sessions, and an assessor will be appointed to you, and they'll come out and see you in the workplace. You'll do your classes with us, and you'll conduct online teaching and learning. You'll complete some workbooks and modules, And then at the end of the apprenticeship, you'll have an endpoint test. And that's normally a professional discussion and a multiple choice question. Now, the level 3 care worker is exactly the same. The only difference is level 2 is designed for those that have less than 12 months industry experience, and level 3 for those that have more. However, saying that, it doesn't mean that you have to start at level 2. We find most people are now starting at level 3 because of transferable skills. And on the 1st of April, the Education Skills Funding Agency asked us to look at people's prior learning and experience and put them on the level in which they will learn new skills, knowledge and behaviours. So if you don't feel that you're going to learn anything on that level, it's not appropriate for us to place you on it. So we have to do a fair amount of work in justifying why we've put you on a certain level. So that's your level 2s and 3s. Moving into your level 5s, leadership and management in care, you need to be in some kind of position of managing a care service or a CQC regulated activities to cover the leadership and management. And that's adults or children. And then finally, we have our assistant practitioner pathway, which is designed for people that really want to work in sector, upskill towards a nursing degree, and wants to work in a more autonomous role. Now, the best thing about our AP program is it's 120 credits and it's linked to the nursing degree. If you complete our level 5 program, you'll have completed your first year of your nursing degree, meaning you will have that RPL, so recognition of prior learning, off your nursing degree. And the Open University is our partner for the nursing apprenticeship standard, and you'll have a direct entry into theirs on the grounds that you pass their interview. So it's important for you to work really hard on the level 5, really demonstrate the theories and models expected at a degree level. Now, throughout all of those, you'll have your tutor to support you through the program. You'll have your internal verifier that you can talk to, who is normally an expert in the industry. And then finally, you'll have your learner support officer who can help you keep on target. Your employer will have identified mentors in the workplace to help you progress. And obviously myself, I'm here for any advice and guidance that you might need. So I wish you all the best of luck. If you need any further information, advice and guidance, please contact your learner support officer, or you're more than welcome to come in and talk to myself. I wish you all the best of luck. Bye for now.